Congenital cataract are slow-growing or progressive. Very slow-growing, hence aka station. Classification of congenital cataract. Infantile, primary, developmental. Age of onset of infantile and developmental cataract. At birth, both. Presentation of infantile and developmental cataract. Infantile, within 1 year. Developmental, after 1 year. Symptoms of infantile cataract. Severe loss of vision, due to interference with foveal fixation. What's foveal fixation? Brain ascertain that the best image is formed on retina at foveal point by 3 to 4 months of age. Failure of fixation causes amblyopia. Management of infantile cataract. Immediate surgery upon diagnosis within 12 weeks of age. Appearance of infantile cataract. Spoke-like opacities, main opacity in fetal nucleus. Types of infantile cataract. Lamellar zonular cataract (MC), autosomal dominant. Lamellar zonular cataract is associated with what conditions? Congenital rubella syndrome, VIT. Symptoms of developmental cataract. Minimal loss of vision. Management of developmental cataract. Wait and watch. Types of developmental cataract. 1. Blue dot cataract. 2. Posterior polar cataract. Which type of developmental cataract is associated with Down syndrome? Blue dot cataract. Which type of developmental cataract is associated with Middendorf dots and PHPV, persistent hyperplastic primary vitreous? Posterior polar cataract. Appearance of developmental cataract. Onion ring, whorled appearance. Treatment of congenital cataract. Lens aspiration plus posterior capsular hexus plus anterior vitrectomy, usually done after 2 years. Why congenital cataract are managed after 2 years age? 1. As eyeball size increase with age and small IOL may dislocate. 2. Power of IOL increase with age. How much correction is needed in power of IOL for congenital cataract surgery? If done less than 2 years, under correction by 20%. If 2 to 8 year, under correction by 10%. Ocular manifestation of congenital rubella syndrome. Nuclear pearly cataract, microphthalmos, salt pepper retinopathy. Axial length of eyeball at birth and 7 years. Birth minus 17 mm, 7 years 24 mm. What's ectopia lentis? Displacement of lens away from its position, partial dislocation, subluxation, or total dislocation. Signs seen with ectopia lentis. Golden reddish crescent in pupillary area. Monocular diplopia may occur. Causes of ectopia lentis. Blunt trauma, familial, autosomal dominant, ectopic lentis et pupillae, aniridia, no iris, Marfan syndrome, homocystinuria, Weil-Marchesani, sulfite oxidase deficiency, hyperleucinemia, Ehlers-Danlos syndrome. What's ectopic lentis et pupillae? Congenital bilateral condition where lens and pupil move in opposite direction. What's most common systemic association for ectopia lentis? Marfan syndrome. Findings in Marfan syndrome. Superotemporal ectopic lentis, flat and large cornea, lattice degeneration of retina, axial myopia, dilator pupillae hypoplasia, increased axial length. Type of ectopia lentis seen in homocystinuria. Inferonasal, diagnosed by cyanide nitroprusside test. Type of ectopia lentis seen in Weil-Marchesani syndrome. Forward, anterior, seen in short-statured patient. Management of ectopia lentis. If partial subluxation, spectacles. If clinically significant subluxation, surgery, refixate lens plus ECA, ICCE plus IOL. What's lenticonus? Cone-shaped lens. Types of lenticonus. 1. Anterior. 2. Posterior. Anterior lenticonus is associated with SAW, Spina bifida, Alport syndrome, Waardenburg syndrome. Posterior lenticonus is associated with Lowe syndrome aka oculocerebral renal syndrome. Lowe syndrome features an inheritance pattern. X-linked inheritance. Features: congenital cataract, congenital glaucoma, microphakia, small lens. What's microspheriphakia? It's congenital defect where lens is small, myopia, and spherical dislocated and so secondary angle closure glaucoma. Microspheriphakia is associated with what other conditions? Marfan's. While